And now on the line is Breda Gahan from Concern. Breda, welcome back to Near FM.
Thanks, Darren, and thanks to your listeners in Near FM for listening in on this topic. Much appreciated.
Okay, Breda, I last spoke to you on Near FM only around 3 months ago when we spoke about World AIDS Day 2023. I got in touch with you today for this interview for another reason in particular, but before we talk about that, can you give our listeners today a bit of an update on your work with Concern over the last 3 months since our last interview, Breda?
Sure, Darren. I think you know my background training is as a nurse in the Mater Hospital, midwifery in the Coombe, and then I took a Master's in Community Health in Liverpool University. So I've lived and worked with Concern for over a decade overseas in 4 countries, in Iraq, Sudan, Cambodia and Mozambique, where I had to learn Arabic, Khmer and Portuguese languages to be able to work with women and children especially, and with National Ministry of Health staff, especially my peer nurses and midwives. And I learned so much during these years in the different urban and rural contexts. And as you know, Darren, Concern always focuses on the extreme poor, working towards improving their education, health and livelihoods to get them out of extreme poverty. Currently, I'm Concerned Senior Health and HIV Advisor. I'm now based in Dublin, and I continue to support technically on health and HIV-related issues, and with health program development and implementation in 16 of Concern's operational countries. So it's a lot. And my colleague Christine, who's based in France, obviously she's a French speaker, so she supports the 8 Francophone countries where Concern is working, and also Somalia and South Sudan.
Okay.
And I meant, as I was reviewing the country reports actually for 2023, following on from World AIDS Day, like you mentioned, on the 1st of December, one of the countries we work, Malawi, continues to have the highest burden of HIV and AIDS of all countries where Concern is currently working. Adult HIV prevalence is 7%. So it's a generalized epidemic in Malawi. 7 in every 100 people are living with HIV. Unfortunately, it's higher for women than men. Women 8% and men 5%. And as in other countries, the impacts can be gender specific, where young girls and women particularly are especially exposed and infected. So it has been affecting women and girls disproportionately, especially in sub-Saharan Africa. It affects lives and livelihoods. You know, we see where farmers or people's livelihoods can collapse if they contract HIV or develop AIDS and they're not on treatment. And also it's been contributing to malnutrition more recently in adults and children, especially if adults and children living with HIV are not enrolled and compliant with their antiretroviral medication, ART, antiretroviral therapy, which is life-saving. And much of the treatment and testing programs, including in Ireland, you know, were disrupted for almost 3 years. So we're not really back on track yet in terms of testing and treatment locally or globally. Kenya, likewise, where Concern is working, has a high prevalence. And I noticed in the last report that testing is down for both men and women in Kenya. And testing everywhere is the gateway to treatment. If you don't know your status, you don't know you need treatment. And testing in Kenya peaked at 53%, which is only just over half, in fact, in 2014. But it was down to 47% in 2022 for women. For men, even worse, it was 46% in 2014. Less men tend to go for testing because women often get tested during antenatal care when they're pregnant, and has declined to 39% in 2022. So with testing down, access to treatment is down. It means, you know, more exposure, unfortunately, to the HIV virus, including here in Ireland, where the stats have been going up. I've been checking them every week since 2024 started, Darren.
Okay, we come back. We talk a bit more about Africa maybe in a couple of minutes, and next question could maybe lead us into that anyway. But we'll move on to the main reason I got in touch with you for this interview today, Breda. Can you start off, Breda, by telling our listeners today what is oral PrEP and who it is aimed at? And then can you tell our listeners what is the big news or development in the care that is in the news recently?
Yes, Darren. I've been reading the headlines like you, and oral PrEP, or what's called pre-exposure prophylaxis, is a daily HIV prevention pill that kind of works like a vaccine. Each medication is a combination of two antiretroviral drugs. It's an oral or tablet form of PrEP, and it is up to 99% effective, imagine, at preventing acquiring HIV from sex with an infected person, and at least 74% effective at preventing HIV being acquired from injecting drug users by sharing needles with a person who is HIV positive. This is the Center for Disease Control Statistics in the US. Now, a new injectable version of PrEP has been rolled out in Zambia, which offers protection against the HIV virus for up to 2 months. So instead of a daily tablet, oral, to prevent HIV infection for people who feel they're at risk and want to take it, this new injection protects somebody for up to 2 months, which is, a great innovation, and
that's brilliant.
Obviously easier maybe to remember to turn up for your injection every 2 months rather than taking medication every day, which people might forget. And especially for women, because they're used to taking, especially in developing countries, tetanus toxoid injection in pregnancy to prevent tetanus to themselves or their newborn born during pregnancy and delivery. So it's not an unusual concept to take a kind of HIV vaccine, for women.
This is great news. Look, I was under the impression, when I read that one of the first articles on this first, I got the impression that that's what it was saying, what you just said there. And then when I was reading more, I got a different impression from it. So this is basically like I believe it's in America already. This new PrEP,
yes,
and now it's in Zambia. So this oral PrEP. So people, I've heard over the years, people taking PrEP who have HIV in Ireland or around the world, they have to take these tablets every day, which are a bit of a pain in the ass taking them. So now you're saying that we're in the process around the world of all you have to do is have an injection every 2 months, and you don't have to take the tablets.
Exactly.
That's brilliant,
and
isn't it?
As I say, it's been rolled out in Zambia at the moment as a pilot, supported by the Ministry of Health there. I'm concerned, used to work in Zambia. I've been to Zambia. So it's an English-speaking country, I guess, easy to do the research. They're supporting it. But hopefully, if the compliance and uptake is good, it'll be supported and rolled out throughout sub-Saharan Africa, which, has the highest burden. I read on another website that experts believe that cabotegravir, which is the name of the drug, known colloquially as CAB/LA, has the potential to dramatically change the course of HIV in Africa, which sadly still accounts for nearly 70% of all global infections. And, this is easy to administer. And like you mentioned, it reduces the risk of people skipping their daily medication. If it's an injection every 2 months, you can put it in your calendar. It means also you can go to the health center, especially for women privately. Women who are not infected, people who are negative can take this if they're worried about a partner who might be positive or a partner who's not 100% faithful. To protect themselves, they can privately go to the health clinic, take the medication, and protect themselves and any future children if they become pregnant, especially for women. But it's available, I believe, for boys, girls, men, and women.
I think you just maybe answered this already, but assuming the new injection breeder can be available across all of Africa, bearing in mind how bigger of a problem it is in many countries in Africa, HIV/AIDS, this new PrEP will, I believe, will it make a big difference in the trajectory of trying to overcome HIV and AIDS, won't it, Breda?
Well, yes. I mean, I think people have forgotten between COVID and other new infections with epidemiological and climate change in terms of measles, malaria, dengue, chikungunya, Zika in developing countries that, almost over 39 million, almost 40 million people are living with HIV globally today. And every year there are 1.3, almost 1.5 million new infections. And the majority are still amongst women and adolescent girls in sub-Saharan Africa. The first young woman who received the dose in Zambia, her name is Miranda Zulu. She's 23 years old. And I read her interview, and she said that the injectable for her is life-changing. It eases her worries about taking a daily drugs program. Nobody can see her taking the medication. And like she said, there is privacy because it's administered by trained and highly skilled healthcare workers. And as I mentioned, privacy for women can be especially important. Maybe their partners don't want to know that they're taking injectable PrEP. And I read also that the injectable PrEP, even more importantly, will be integrated into the normal health service delivery system in Zambia. So it's giving, anybody who goes to the health services, and again, it's usually more women, antenatal care, safer delivery for their babies, postnatal care, and any new people going to health services, it gives them another option for HIV prevention. The drug, like I said, was shipped to Zambia from GSK, GlaxoSmithKline, from a facility actually I read in Durham in England. And, based on the numbers, 1.3 million new infections annually, the biggest unmet need for HIV prevention is unquestionably in sub-Saharan Africa still. But I think we shouldn't forget what's happening here in Ireland when we see the HIV numbers increasing every week. In fact, they come out every Wednesday, so it'll be tomorrow. Maybe it will be introduced by the Ministry of Health in Ireland. I don't know, but I need to talk to my colleagues in HIV Ireland and other groups to see, what the possibilities are. I mean, prevention is definitely better and more cost effective than lifelong, daily antiretroviral medication to stop HIV establishing in a person. And there's still no cure for AIDS, Darren. Without treatment, people will die.
And some people do still die, don't they?
Yes, absolutely, because especially, as I say, testing and treatment was disrupted really during 2020, 2021, 2022. It started to come back in 2023. As the data is being collected, we're only really knowing and understanding, because obviously data is a couple of years behind the report. We're only really discovering now what the interruption of HIV testing and treatment services has impacted negatively in Ireland and in other countries. And, if this can be resourced, because of course all injections cost money. You need needles, you need equipment, you need health workers, you need the supply chain, and this was affected during COVID, and costs have gone up now in terms of transport with the current wars in Ukraine and in Palestine. But if it can be rolled out in sub-Saharan Africa, I think it can make a big difference. And, concern with our teams and our national partner staff and ministries of health can support with promotion and education. Once we know it's safe, it's doable, and to increase the necessary HIV testing, and then to promote the PrEP uptake, whether it's oral medication or the new injectable, which women think they would prefer, especially among the most vulnerable and at risk, and like I said, especially among poorest young women and adolescent girls. And Irish Aid, being Concern's main donor, is very supportive of the global HIV response, and especially in Africa.
Okay, Breda, I won't keep you much longer. I know you're very busy this week. we're talking there about just with the new PrEP, like even in Ireland and in Europe, where we have antiretroviral treatment for everyone if they need it. Like there is an issue even in Ireland and Europe of people being on PrEP, oral PrEP, and not taking their tablets for whatever reasons. So, like, if this new PrEP injection comes into Ireland and Europe as well as Africa, it will make a big difference, even in Ireland and Europe, won't it?
Yes, I mean, like I say, daily medication for many people is hard to remember, or people are out socially, they forget, and even I was looking up the treatment stats at the end of 2022, the latest data. Of the almost 30 million people currently living with HIV who are on treatment, that's only 76% of the population of people living with HIV. Currently, 10 million people living with HIV do not have access to treatment. And more children who are HIV positive don't have access because the pediatric formulations are not available in quantity and in terms of accessibility for poorest children in Africa especially, and often the children haven't been tested. So, like I say, every HIV infection is a success. Every HIV infection averted is a success for an individual, a family, a community, and a country. And the stigma is still ongoing. I would say it has increased post-COVID because people almost think, oh, sure, HIV is finished with. We're done with that one. Maybe we better watch out for the next pandemic, or we're still dealing with the sadness and impacts of people who died during COVID and the social impacts. So there's definitely more to do on HIV prevention and expanding HIV treatment here in Ireland, locally and globally, Darren. And like I said, concerned teams are supporting HIV and AIDS, the SDG, Sustainable Development Goal 3, remains to end the epidemic of HIV and AIDS by 2030. So we've just 6 years left. AIDS is not yet over, unfortunately. And I do believe that oral and injectable PrEP are welcome additions in terms of preventive measures. But let's not forget safer sex behaviors and practices, clean needles, 100% correct, consistent condom use, not engaging in sex until young people are ready. Every preventative avenue needs to be employed to prevent infection. Once young people, or I would say even before, I think children need this education in primary school in an age-appropriate way. Many of poorest children don't ever get to secondary school in Africa or Asia. So, and what's wrong about educating people in terms of a life-saving practice that might prevent them contracting HIV? You won't get entry into some countries, if you're HIV positive. You won't get residency in some countries. So although treatment, and many people in Ireland now are living positively with HIV on treatment, it does stall your sort of travel options in the future and maybe your work options. You might not get work in some Middle Eastern countries. So all I say is, onwards to ending HIV and AIDS by 2030, Darren.
Just Breda, like even assuming this, which you will, I imagine, this new PrEP, even when it's available across, say, the Western world and in Africa and Asia as well, like I believe it's going to be more expensive in the Western world, whereas in countries that have a crisis, hopefully it'll be a lot cheaper to be rolled out. But it's still going to cost, like even if you just take Africa, it's going to cost, I believe, tens of billions of euro more in funding to get everyone who has HIV onto treatment. Like to actually reach the goal where everyone who has HIV is on treatment and there's a reversal, so there is no new HIV cases every year. That it will cost tens of billions of euro more every year, will it, Breda?
Yes, all medications are increasingly expensive, as we're seeing here in Ireland. And then in terms of, it's not just the medication, it's the whole supply chain, the transport costs, getting them in to health systems that can safely deliver them. Sadly, with conflict and interrupt supply chains, I'm working on with our teams in Ethiopia and Sudan this morning. Health systems are collapsing, due to conflict, epidemiological and climate change, and new infections, like I say, increasing again that we thought we had dealt with, like polio, measles, cholera, dengue, malaria. So there's competing interests. So investment in health is a must. Health is wealth. I keep saying it. An economy has to invest in the primary asset every country must have. I mean, we saw what COVID did. The whole economic world collapses when a global infection or pandemic, as it became, occurred for nearly 3 years, and some economies are still only recovering. So countries and governments, and we need to advocate with our politicians, that the priority is to invest in health, to save lives, to protect lives and livelihoods, to keep mothers alive, to protect children. I mean, it's a no-brainer. It's a given. And, we have issues, as we know, with our health services here in Ireland. We see the trolley numbers. The system is under capacity for the need at the minute, based on population growth and lack of essential resources, often which are human resources. Frontline health workers are not being paid enough to be retained. And we see the same issues in developing countries. And brain drain is happening where, nurses are coming from developing countries to northern countries, and then they don't have their best skilled people on the front line. Like I say, looking at the needs this morning in where concern is working in parts of conflict-affected Sudan and Ethiopia.
I remember hearing. Do you remember about 10 years ago we had that Minister for Health, Dr. James Riley, and he's actually obviously a doctor himself. He comes from that background, but I remember him saying himself that the trend, and I know it's going on for over a century, I know, but the trend of nurses and doctors who are from developing countries leaving those countries where there's a bigger demand for them, but leaving those countries and to work in Ireland and the Western world or Europe, he said it's perverse. I think that's the term he used. Like, it's kind of unbelievable the way, like, there is more of it. Like, I know we should if we have a shortage of health professionals in Ireland, we should welcome people coming into the country. But there's actually people coming from, let's say, India or whatever. There's actually more of a demand for them in their own countries. It's kind of a bit mad, isn't it?
It is an ethical dilemma I think about a lot, absolutely, and talk about. And, if we're bringing people, it's not just Ireland, it's most of Europe, it's England especially, so many health workers there are from southern countries. Well, then, yeah, we need to invest in southern health systems, because every infectious disease now is just a train ride or an airplane flight away. That's the reality. And we saw that during COVID. And there will be future epidemics and pandemics. And I am very concerned when I read all of the 26 concerned country reports for 2023 and see the increasing mentions of outbreaks, that wasn't at the same level pre-COVID. It definitely wasn't at the same level. So look, from north and south, from EU to USA, to Africa to Asia, governments need to be advocated to invest in health. Now, some countries like the Philippines and parts of India do overtrain because they know people leave, but that's often not the case in Africa, which still, the negative impacts are huge.
And we have to invest in our own health systems in Ireland as well. So ideally we should have enough of Irish people entering the health profession as doctors, nurses, and midwives every year, so we don't have to depend on other countries. Would you agree with that?
Well, absolutely. They need to be supported to stay in this country. I worked in the Mater, the Coombe, St James's, three big hospitals, and it was some of the best experiences of my life, although some of the saddest in terms of dealing with very sick people. But, it's a wonderful way to work and meet with people, and, it's a privilege to be able to support people during their greatest health needs. And I think, all ministries of health and governments need to look at how we can rectify this so that there's greater equity and fairness in terms of health service access and, primary health care in terms of preventative medicine. A lot of the increasing burdens of disease beyond infectious diseases are actually what's called, even in Ethiopia this morning, non-communicable diseases, from hypertension, obesity, heart disease, cancers, breast cancer, cervical cancer, and Schleunte care in Ireland hasn't been rolled out in the way it was planned just yet, as far as I can see. Because, I learned first about primary health care 36 years ago in Sudan, in Wad Medni University, preventative health care. And even then I thought, wow, this is, what Ireland needs. We need more investment in preventative health care. In Ireland, I would say we don't have a healthcare system. We have a sickness care system. You enter the system when you're sick. And now GPs and everybody is overburdened because people turn up when they're sick rather than focusing on all the things we can do to prevent ill health. And a lot of cancers are increasingly preventable. Obesity a lot of obesity is preventable. There's some genetic aspects, obviously. Diabetes, likewise. But a lot more is preventable than all governments or all ministries of health deal with. People enter the health system generally when they're sick. And then the treatment costs are much more, and the investment costs are much more. People stay in hospital longer, need treatment longer. Like I mentioned, imagine the costs of PrEP, preventing HIV, to treating HIV for life, if somebody has HIV, so that they don't develop AIDS. I mean, it's a no-brainer. Prevention is best. So let's hope at the next election here in Ireland and in all the other elections coming up, concern with our partners, we do advocate on these issues all the way from, I say A to Y now, where we work Afghanistan to Yemen. Even, in diverse countries like that with conflict, and they're not stable, easy situations to work in. But we have to talk to them. I mean, injured soldiers need health care, during conflict. Health systems need to be there for everybody. Better if it wasn't for conflict and war, but better if it was for primary health care and preventative health care for everyone.
I won't keep much longer, Breda. Sorry for keeping you for longer than we thought, maybe. But I know one of the best things I believe that's happened to Ireland in the last 15 years is we've had a big increase in the number of primary healthcare centres in Ireland, and these buildings look physically beautiful, like they're very modern, and there's loads, and I think it's something like over 100 of them, or around 100 around the state now. But the problem is, most of them, they don't have enough staff. Is that the case, is it?
For the modern, sorry?
Primary healthcare centres in Ireland.
Oh, yes, I looked up the Schleunte Care website yesterday, and I was sharing it with my colleagues overseas to say to them, well, we do have a programme, at least on paper, but implementation, like in their countries, is weak. And yes, as far as I understand, it's the biggest lack of resources are human resources, but then obviously spaces and centres. You need a centre or a location, like we support health centres. That concern probably supports more health centres and health clinics, small clinics in urban, slum, and rural areas in Africa and Asia. And we need more of those kind of clinics in Ireland, especially as GP services are being overwhelmed.
Uh,
So that, everybody works on protecting their health rather than putting the health, I mean, we're all guilty of it, putting health issues aside until we get a fever or a pain or an ache, and then we go to the doctor.
I think there has, I believe, been a big increase in the number of the actual centres, though, in the last 15 years, hasn't there?
Oh, there has, yes. And even around here in Dublin 7, Dublin 1, Cabra Phibsborough, I've seen them. And no, I think that it's great, And I think, again, primary health education in primary schools, it's a life skill. I think it should be on the curriculum, as in, protecting health. Like, don't cross the road. We see all, sadly, the accidents recently, road accidents, traffic accidents. Essential life skills in an age-appropriate way, not to scare people, need to be included in primary school. Like, from road safety to sexual health safety to unplanned parenthood, or as I say now, rather than just pregnancy, because, fathers can be found preventing, underage teenage pregnancy, and like the age of consent in Ireland is 17 anyway, and, promoting and debunking the myths about, vaccinations, especially for the 6 major diseases. Like, we see TB increasing. Like, BCG is the first vaccine children get. Then it's the DPT, diphtheria, pertussis, tetanus, and polio. Pertussis is whooping cough. I've seen that come back a bit. What am I mixing now? And then there's measles, obviously. There are the 6, but, measles is increasing. Well, there are outbreaks in parts of England at the minute. I'm sure they will come here because herd immunity has dropped as people haven't continued to vaccinate in the same way as they did in the past, or maybe pre-COVID. And, science-based health education, needs to be included in primary education, I think. Just like dietary education, good nutrition to prevent obesity and the unhealthy consumption of over-sugary drinks and other things. And we're beginning, but, we're already dealing with a big burden in this area. And we can see it, We didn't have access to all this processed, packaged, canned, tinned food when we were children. And you and I are not that old, Darren.
Yeah.
But, there weren't all these fast food restaurants available, so we didn't go to them. I lived in, rural County Wexford on a farm. Never saw a fast food restaurant until I came to Dublin when I started in the Manor Hospital, and there were very few at that time. So, there's a lot of work to do to promote primary health care and preventative health. And anyway, a bit like the injectable PrEP, every, support that can protect health is welcome, but a lot more needs to be done in terms of health education, promotion, and encouraging people. We all have to take our own responsibility a little bit, our parents, with their children.